This tray setup is for the crown prep. So first off we have our mirror, which is just used to examine the mouth for indirect vision. We have our Explorer, which is just used to examine the tooth for decay or any other abnormalities, calculus. Cotton pliers, this is used to retract like 2x2 rolls out of the mouth or to grab instruments from the back counter. We have our spoon excavator, and that's used to scoop any of the tooth structure that's still remaining. We have our curette that removes the subgingival calculus. And then we have our Woodson, and that's what we're going to use to really pack in the retraction cords. Also could be a gingival retraction cord packer. Our mixing spatula that we're going to use to mix our IRM, articulating paper that we're going to use to check occlusion, counter bridge scissors, which are just used to cut any necessary items. We have our anesthetic aspirating syringe. This is what we're going to use what doctor would use to numb the patient after we place the topical. 2x2 gauze, this is used to wipe any instruments or to dry an area before topical is placed. Our mixing pad with our spoon, IRM powder, and IRM liquid that we will mix together. Our HVE to suck up any debris, blood, and saliva. Our saliva ejector that we would use to suck up blood and saliva. Hemodent, this is used to stop minor gingival bleeding. Our air water tips. Our triple tray bite registration that we would use in the mouth to get the bite, and then our quadrant tray that we will use to put in our light and heavy body to make our impression. A burr block depending on the different burrs the doctor wants. We have our temporary crown material, and that's what we would use in the meantime while the permanent crown is being made. Our topical and our cotton tip we will use to place it before doctor gives the anesthetic. These are retraction cords in different sizes. Our adhesive that we would use in our quadrant tray so the material doesn't get stuck to it. And then we have our light body and our heavy body, and then the tips that the material gets mixed in that we would use in our impression. And then we have our shade guide that we will use to match with the adjacent teeth next to it. And then our hemostat, and that's used to grab tissue or any other bone fragments that there might be.